Today we'll be discussing the topic of how to manage feed intolerance in low birth weight newborns. So these low birth weight newborns are very tricky to handle, and you have to check their feeding, how they are taking it, whether it's going appropriately or not. I have covered in the previous video of how to start the feed in neonates depending upon their gestational age and maturity. So let's consider that these low birth weight newborn is having feed intolerance and is regurging, vomiting, and you notice that there is some abdominal distension. You have to start by measuring the abdominal girth. If there is increase in the abdominal girth by 2 centimeters and the newborn is repeatedly vomiting, then you have to aspirate out the gastric content, that is the previous feed which you have given, and you have to check the nature, that is the color of this aspirate along what is the volume of this aspirate. Let's differentiate depending upon what is the nature of the aspirate. If it is bile or blood tinge, then you have to stop, that is withhold the feeds for 24 to 48 hours, and you have to rule out till then the systemic cause leading to it. But if the aspirate is not bile or blood tinge, then you have to check the volume. If the volume of aspirate is less than 25%, then there are some local causes causing the vomiting. But if the volume of aspirate is 25 to 50%, then you have to decrease the amount of volume of feed in the next feed. If the volume of aspirate is more than 50%, then you have to withhold one or two feeds. By doing all these measures, depending upon the volume of the feed, even if the neonate is again having vomiting, abdominal distension, when you are kept the neonate on a continuous monitoring, you have to find out whether the neonate is clinically stable, hemodynamically stable, or there are any systemic signs. Let's consider that the neonate is having no systemic cause and he is hemodynamically stable. Then you have to check the position of the OG or the NG inserted. You have to keep the neonate in a prone or a right decubitus position. And most of the time, these neonates tend to resolve with this small measure itself. But let's consider that the child is not hemodynamically stable and there are some systemic causes. In such situation, you have to withhold the feed for 24 to 48 hours and then proceed restarting of the feed from basal feed, increasing in the subsequent feed depending upon the protocol that you have followed in the NICU. If you like this video, please give a thumbs up, share it with the friends who may need it, and subscribe to the channel. This is Dr. Hemangi Reddy.